First things first, there are 1,438 new cases notified yesterday, all locally acquired. That brings us to a total of 11,018 active cases across Victoria. This is more than a 50% increase on yesterday's daily numbers, and I'm sure that'll be a great concern to all Victorians. We've been very clear these numbers would go up. They go up faster, of course, if people don't follow the rules. They go up faster if people are out visiting each other in their homes. That's not a sense of blame. It's not about trying to do anything other than deal in the facts. And what Jerome will speak about in a moment is some trends, very, very clear trends, from case interviews and from the data. Not guesswork, not the notion of blaming someone else. This is the reality that every single Victorian, including the government, faces. If people continue to visit each other in their homes, then they will bring the virus with them. They will spread the virus. And look, I don't think anyone necessarily who makes that choice thinks that they're going to be spreading the virus, but that's the reality of this thing. That is the reality of this thing. And 4 or 5 days after, the Thursday after a long weekend, and particularly given what we know from interviews over recent days, many of these cases were completely avoidable. Now, of course, they will add further pressure to our health system, and they will lead to more people being seriously ill. So I know it's frustrating. I know it's incredibly hard. I know this has been literally the longest journey, but we can see to the other side now. And that's why it's so important that we just find it in ourselves to do the right thing, do nothing to add to the spread of this virus, do nothing to add to the number of people who our nurses have to care for. And I know it's difficult. It's very difficult. We are all craving and longing for that personal connection, being able to spend time with each other, being able to get back to normal. There's nothing wrong with that. That is a perfectly natural thing. Pretending, though, that the rules don't apply to you, or pretending that I'll be fine, I won't catch this, and I won't give it to others, well, the data and the facts tell a very different story. We can't change what's gone on in the last week or so, or in many respects, at any point. That's all done. What we can do, though, as we head into another weekend and as we get every day closer to that 70% double dose, we can all of us try and make the best choices possible for ourselves, for our loved ones, and indeed for our nurses who are there caring for patients. And it's not easy. It's very, very challenging work. Let's not any of us make that work harder by making the wrong choices. I can understand it. I can appreciate just how challenging this is, but that is one of the biggest drivers. It's not the only driver, but it's one of the biggest drivers with these numbers. I'm not trying to blame anyone. I'm simply trying to explain, because a lot of people will be scratching their heads today. How could it have gone up by so much so fast? Well, not theories, actual interviews. Actual interviews tell us that many hundreds of people, perhaps thousands of people indeed, have made some choices that meant they're spending time not in their own home, but in someone else's home. And that's how we know this virus spreads. That's how this virus gets across the community. Now, I am saddened to have to report that there have been 5 people who passed away, a woman in her 70s and a man in his 80s, both from Whittlesea, a man in his 70s from Moreland, a man in his 60s and a man in his 90s, both from Hume. We, of course, pass our very best wishes and sympathies and sincere condolences to those families. This will be a very difficult time for them. Speaking of difficult times, any COVID patient who's in hospital is a challenging patient to care for because they have a wildly infectious virus. There are 398 people who are currently in hospital. 83 of those are in intensive care and 57 of those are on a ventilator. We send our best wishes to them and their families, of course, and we of course take this opportunity to again thank the many health professionals and the teams of people in our hospitals who are caring for them. They're doing their very best. There's some pressure there. That pressure is going to grow. I'm confident that we've got the resources that we need. We've got all the things you can control, whether it be machines and PPE and all the all the different consumables that you need to treat each and every patient. What is the biggest limiting factor is essentially fatigue. Our health professionals have had 20 months like they've never had before. That's why I keep making the point, let's not any of us, so no one in Victoria should be adding to the burden and the workload and the task that our nurses have right now and that they're going to have in the weeks and months ahead. That's the price of us opening up. Our hospitals are going to get very, very busy. But let's not make that any harder than it already is, because those nurses and doctors and ambos and all the team, they are tired. They are fatigued. They've had a very, very busy 20 months, COVID and non-COVID, as a result of all the other decisions that we've had to make. So let's not make their work any harder by making really poor choices and going and visiting mates and friends and family and taking the virus with us. That's what happens. Let's not be doing that as we look to these weeks to come. I am delighted to say that we have officially ticked over the 80%. We're at 80.3% first dose. We're at 49.5% second dose. Those numbers continue to grow. If you look at the New South Wales experience, once they got over 50% double dose, there was some inherent protection. It seemed a significant milestone in terms of driving down case numbers. I must say I'm very, very impressed with Hume, so the north and the west. So those northern and western local government areas where we've seen a concerted effort, really hard work on behalf of so many people, but we've made getting vaccinated in those areas a real priority. And those numbers have lifted strongly, really strongly, over the last couple of weeks, from in the sort of high 40s to 50% range single dose. They're now, I think, all of them above 70, and some are even doing better than that. So that is about saving lives. That gives people protection that they wouldn't otherwise have. So I want to thank everybody who's administering vaccines, everybody who's out there convincing people to go and get a vaccine, and of course people in the north and the west who've gone and made an appointment, whether it be with a pharmacist, with a GP, or coming to a state hub, or coming to one of the many pop-ups we've run. That is the best of work, the most important work. Beyond that, there were 34,323 vaccines administered yesterday, and just under 65,500 tests. So a very good test number, and another good strong vaccination number in our state hubs. And we again thank people for coming along and getting that done. And we thank the people who are doing that work, of course, and we extend our thanks to GPs and pharmacists as well. As I stand here, though, there are 10,000 first dose Pfizer appointments and 8,800 first dose AstraZeneca appointments available in state hubs over the next 7 days. So 10,000 first dose Pfizer and 8,800 first dose Astra available in state clinics, state hubs. Go online right now, put your name beside one of those appointments, play your part, and get us free. Get us open, because you'll be helping to get us to 70% double dose faster.